My name is Dr. Senga. I'm one of the intensivists. I take care of patients that are admitted to the ICU. I take care of patients that are critically ill. We have been taking care of patients that are positive for COVID or coronavirus, that get sick enough to require hospitalization and even sick enough to end up in the ICU. I've been taking care of some of those patients. These patients who are sick, really sick, they're in a room that is considered a negative pressure room. Even if the viral particles are aerosolizing, they're going into the room. They're not just staying stagnant there. They're getting sucked out, and then they're going through a filter. Then that just kind of captures it. So what it does, it lowers the amount of virus that is just staying out in the air. The virus is still pretty much here. Actually, back in March, when this all started, mid-March, I noticed that everybody was freaking out and panicking, and we were seeing very few cases at that time. And now we're seeing a lot of cases, and everybody has forgotten about it, and people think that it doesn't exist anymore. Back in March and April, of all the tests we were performing, about 1 out of 10 or 10% were positive. Now more than 50% of the people that we're testing are positive. So we still need to take all the precautions to make sure that population at large is not getting infected at the same time, so that we don't get overwhelmed or bombarded with patients. We're taking basically all the precautions necessary. We're dressing up to go into these rooms. Everything comes off. So the doctors obviously have to. So if there's 7 or 8 patients admitted there, I have to see all the patients. If I'm going into one room, I dress up completely. All those things come off. And even the mask, we don't reuse it, we throw it away. We're doing everything we can. But I think the community can also do its part by just still taking the precautions until we get the disease under control. And the way we will know that is when people are not testing positive every single day, or no people are turning positive is where we want to be. But right now, that is not the time.